Time for some clinical peanuts.
We have Dr. Arnav also has joined. Do we have Dr.
Yeah.
Arnav? Yeah. So
Yes, sir.
I think we'll go ahead. So today's session is a very interesting session. We are basically going to talk about the exam by All India Society, which is FAICO. So this is a very popular exam I am seeing, and everyone wants more information about it. But I feel that curriculum wise and how to go about the preparation wise, there is not much information available. So I thought that we'll catch up to best people to tell us. And so today we have with us Dr. Isha and Dr. Arnav. So Dr. Isha is a fellow in vitro retina from Narayan Netralaya, and she completed her vitro retina ROP and UVA fellowship. She also has a strong passion for academics, and she also got her best poster award in 2023 Asia Pacific Academy of Ophthalmology, and which was subsequently followed by the Heroes Award from All India Ophthalmic Society. So I welcome you, Dr. Isha. And the next, our expert is Dr. Arnav Saroya. Now, Dr. Arnav Saroya is a fellow in refractive from Agarwal's Eye Institute. He is also a fellow of World College of Refractive Surgery and Visual Sciences. And he has also been awarded various grants from APRS, and even he has received a scholarship from Champion of the Champions. Okay, and he'll be talking about how to go about with the refractive part. So, Isha, I think you can go ahead.
Okay, sure, sir.
So I
And thank you so much, sir, for giving me this
see your slides,
opportunity.
Isha. You can, I think, just
You can see
share
my
your.
slides, right?
No, we are not seeing your slides.
Yeah, it's not there. Now is it visible?
No, I can see myself.
Okay, just a second. I'll just share again. Now,
Let's. No, we are just seeing the Zoom window.
it's, I don't know what's happening. It's only asking me to share the screen. So I've already shared my screen. So it should show
So you can just
this.
minimize this Zoom window and maybe open the
Right.
PowerPoint.
Right. Now is it visible?
Mm,
No?
uh, no, I think no, not yet. You can
I
see
have
the
minimized.
PowerPoint on your screen.
Yeah, I can see it.
I think then you can go ahead with the because or else if it's a small file, then you can share it across and I'll share it.
I'll just share it. Yeah, I think I can do that. Okay, I'll do that. Can't see my screen or anything.
We can see your screen. Uh, we are not seeing the slides.
Okay. I'll just share with you. Just a
Okay.
second. Can you see? I've sent you the slides.
Yeah, it's just loading. Yeah, can you see the slides?
Yeah, you can put it on a slideshow, I think.
Yeah. Are they visible?
Right.
Okay, Dr. Isha, please go ahead.
I think you need to minimize this slide that is coming.
Okay.
Okay. Right. Yeah, should I start?
Yeah, please.
Okay, thank you once again, sir, for giving me this opportunity. So, this topic is something that is definitely going to help all the juniors as well as seniors, whoever are thinking to prepare for this exam. And so, I'll just start with the introduction part. Can you go to the next slide?
Yeah.
Right. So, what is FAICO? It is a fellowship of All India Collegium of Ophthalmology, and it is something which is recognized by the AIOS. So, in our particular field, I don't think there is any specific examination or a standardized examination for a super specialty. While other fields like medicine and surgery, they do have MCH and DM, so which is properly recognized. So, this is one big opportunity to be recognized as a super specialist. So I think that's the best way to start with. And other than that, this is the particular site of AIOS that gives you all the information regarding FAICO examination, and it displays everything whatever is required. I'll be discussing briefly regarding all the important things that are needed to begin with. So in the next slide. So, what all awards does it provide? It is a subspecialty examination which can provide you awards for glaucoma, retina and vitreous, cornea, comprehensive ophthalmology, refractive surgery, uvea, cataract, pediatric oculoplasty, and neuroopthal. So, it covers everything, and all the subspecialty is all the subspecialty examination is included in this. So one thing that is important that they mentioned that at one time a member can apply only for one specialty, while he can do a maximum of two specialties. So supposedly if you are giving an examination in one particular year, you can only apply it for one field. In the next year, you can give another specialty examination as well, but maximum you can apply for two examinations. So this is one thing that is important. Okay, next slide. How to apply? So we have online platform, and I think it's the easiest way to apply. But other than that, there is this form that you can fill and submit it to Dr. Santosh on our main email ID, and through that also you can apply. Okay, next slide. Okay, so now important thing is what is the eligibility criteria. So most important, you have to be an AIOS member, and you must have a basic postgraduate qualification recognized by the government of India, like MD, MS, DNB, DO, and also some recognized international qualifications as well. Other than that, you must have minimum 2 years of experience in that particular subspecialty field after completing your post graduation. It can be a fellowship, it can also be a senior residency. So you must have completed that particular fellowship of at least 18 months to be eligible for this exam. Or if you're doing a senior residency, again 18 months in your senior residency in that particular field. And you must have at least, and if you have not done any of these, but still you have an experience of 3 years of practical work experience in that particular subspecialty, even then you are eligible for the examination. And most importantly, when you are considering these 18 months time, it has to be by September 30th of every year to be eligible for this examination. Okay, next. Right. So this is the examination centers that were given for the 2024 examination. It might change depending on every annual basis. So you must keep checking the website. They must keep changing the sites. So most importantly, the written test would be carried on in the metropolitan cities like New Delhi, Mumbai, Kolkata, Bangalore, Chennai, and Hyderabad. While OSCE and VIVA, that has to be seen on your mail IDs because that keeps changing. Again, they must be including most of the metropolitan cities for that. So just keep checking the website to be updated. Next. So this is most important that it is a three-stage examination process. The stage one is MCQ based, which has 60 MCQs. Stage two will be OSCE, and stage three is the VIVA. Next. So now important thing is that stage one is a one separate examination that you have to clear first to be eligible for the examination two, which consists of both stage two and stage three. Stage one is an MCQ based examination, as I told you, in which the questions that are must know questions would be 50%, while moderate and hard questions will be 25% each. And there is no negative marking. So you should, I think, there is no negative marking. You should always attempt all the questions. And most importantly, if I'll tell you what is the difference between examination 1 and 2, what I personally felt, that examination 1 is more of a theoretical knowledge based examination. It is more of memorizing things, while examination 2 will be purely clinical. So whatever you are doing in your OPDs, in your OTs, everything you need to apply in your examination 2. So for examination 1, how do we prepare? I'll be telling you in the coming slides. Yeah, right. So before starting, there has to be, I think, minimum you can give is 3 months study strategy plans. So in the first month, because if at all we are out of touch of all the PG education that we had done, so we need to re-revise all those things. So whatever textbooks, the standard textbooks we had read during our post-graduation time, it's best to start with those. Best book, as we all know, is Kansky to start with, because many people go about with this particular book. And other than that, what I had personally done was also following the BCSC books of AAO. That definitely helps a lot. So what you can start doing in the first month is you'll start revising and reading the whole text all over again, and just uh, targeting yourself that in 1 month you need to complete the book and your whole subspecialty topic in that. In the second month, you can, whatever the things that are remaining in the first month, you can just carry on with your second month preparation. Try to complete the textbook, and other than that, start solving some questions, start seeing some management protocols. You can read all the landmark trials once. And after you have done with your second month preparation, in the third month, most important is more and more MCQs. So what are the sources of MCQs and everything, I'll be telling you that. But the more you solve it, the more you are quick to solve during your exams as well. And that's how you should go about. Next slide. So these are the study materials. As I said, Kansky to go with. Then the BCSC textbooks for each and every subspecialty. There is one book entitled for that. And these two are very important MCQ books that can even help you in other for clearing other international examinations like FRCS, FICO, and FRC off. So these two books are some standard books for for MCQ solving. It is the Kenneth and the Masochist. Next slide. And apart from that, you can go to the online resources like PubMed, AAO, all the standard international websites. And also you can find some interesting MCQ questions in the IQ ophthalmology exam revision. Okay, next. Right. Now, another thing that is very important is to be updated, to have all the recent updates with you regarding that particular subspecialty. And to go about with that, you can use PubMed or Google Scholar alerts like Retina clinical trials. You can write 2025. It will show you all the latest trials, latest studies that are happening. And other than that, we can also follow some key ophthalmology journals, the high impact factor journals like Retina, Ophthalmology, JAMA, and most importantly, since it's an Indian examination, it's important to follow the Indian Journal of Ophthalmology for sure. So that's how you have to go about it. Next slide. Now, since I have recently cleared FAICO and I have done Retina Vitreous, so what's important in the Retina topics that I can tell you. So for MCQs to begin with, it is, as I said, it's more of memorizing. So the history of all the imaging system, which ophthalmologist invented what, that needs to be memorized first. And other than that, anti-VEGF injections, other drugs used in retina, their details, not just the name and the mechanism of action. They can also ask you molecular weight and everything. So you have to be thorough with your memorizing part. Then OCT and other imaging modalities, OCT types and other details like what wavelength of light is being used, everything can be asked. Then any new drugs in this field, that can definitely be asked. And some important tumors like retinoblastoma, choroidal hemangioma, you have to memorize each and everything about them. And definitely the landmark studies and trials associated with diabetic retinopathy or ARMD, you have to be thorough with those trials and studies. For OSCE and the VIVA part, as I have told you, that it's more of a clinical thing. Whatever you are applying in your OPD, that is the thing that will be asked. So you just do not have to memorize the theoretical things. It's better to know what's the approach to that particular disease entity, like PDR, a generalized topic, but then there are many things in that which can come, and how to apply in your OPD clinics, everything will be asked and judged based on this. So PDR, ARMD, PCV, some dystrophies can be given as an image based OSCE question. So it may involve again all most important topics. It don't go towards your rare syndromes and everything. That is something won't be asked in your OSCE or the VIVA. Always target on the most specific and most important topics in that particular field. So dystrophies, trauma, and imaging modalities, instruments, drugs, and surgical steps. So these last three topics will be mostly given in the VIVA. So they'll just show you one particular drug and then they'll ask you what the indication is. And similar goes for that particular instrument, which surgical step you would use. So you should be thorough with your clinical knowledge in that particular aspect. Okay. Next, this is I've covered. I think it is coming. Right. So, what are the standard society guidelines that also you need to follow? For example, in retina, what is being followed in VRSI, that is your Indian society, and then international is ASRS. Again, different and separate societies for glaucoma, cornea, and all other fields. You need to be thorough with what the guidelines are. So, be better versed with them. Okay. So most importantly, why do we need this? So the best part is that it adds another credential to your name. So that is one of the most important part. Secondly, it validates your clinical and academic proficiency. Third would be it adds credibility to your subspecialty practice. Obviously, as I said, there are no standardized examination in the field of ophthalmology, and that's why this is how this particular exam definitely adds credibility to your field. And most importantly, recognition among the peers and gateway to any academic and leadership roles you want to find out. And most importantly, the next slide, to put a Facebook post once you receive the award. That's the, I think, most proud and best moment. And this is how I just received the award. And lastly, there are some take home messages that I would like to give. Next slide. Next. Last slide. So this would be my take home message, that FAICO is definitely achievable with focused preparation. It's not like oh, we'll just think of giving FAICO, we'll do 1 to 2 weeks of preparation and then we'll attempt. maybe some people might get through, but if you really want to go through it, it's good to do a beforehand preparation and everything. So that is how it is definitely achievable. And you have to plan early, you have to revise smartly. Revision is the key. So what I had done was that I kept putting some last minute notes in particular notebook, so that in the last week, whatever the memorizing things are, you can just see those things and then go and attempt the MCQ exams. So definitely it should be a smart revision. You cannot revise each and everything in that particular field, so go about that. And definitely practice MCQs, practice regularly. Clinical knowledge and clarity and confidence are the key, especially during your examination too. That is the VIVA was, because clinical knowledge is what they are testing at the end. And ultimately you have to be stay updated. You should know all the recent guidelines, the recent landmark trials, because that can be asked both in your MCQs as well as your VIVA. So that's it from my side. I think all the best to whosoever are applying this year, and I hope this will help them.
Okay, thanks.
Thank you, sir.
That was lovely. So this was more from a retina perspective. I think we have Dr. Arnav
Right.
here. Dr. Arnav, do we have you online?
Yes, sir. Yes, sir.
Yeah. So can you tell us about the other end of the spectrum from refractive, and so how was your exam, and how did you go about it, and the preparation part?
Sure, sir. Sir, shall I share the slides?
Yeah, you can please. And I think there's
Sure,
a
sir.
bit of I realize that subscription has expired, so maybe the meeting will end in a few minutes, and we will re-log in with the same EA. Okay. Yeah, no, please.
Okay. Yes, sir. I'm just sharing.
Yeah, please. Yeah, now are you able to share your slide?
I think, sir. Yes, sir. Yes, sir. Just one second. So there was some technical glitch. Now it's
Sure.
okay, sir. Just one second.
We'll take the questions at the end of the session. So those who are putting in the chat, please stay on. Yeah, no, please.
So I've shared, sir. Is it
Yeah, now we can see your screen.
is it visible?
The slides
All
are
right, sir. Just
visible.
one second.
We are seeing
Sorry.
the screen bar.
Yes.
Yeah.
Are the slides moving?
Yeah, we can see.
All right. Good evening, sir. Good evening, everyone. I'm really honored to share my 2 cents on the FICO refractive surgery preparation. Thanks a lot to Anuj Soni sir for inviting me to share thoughts with everyone. So I've completed my BBS MS ophthalmology, have done my fellowship in cataract cornea and refractive surgery, and followed by FEICO in refractive surgery and FWCRS. So I think Dr. Isha has given us a complete description of how to prepare for the FEICO exam. And more or less, the format of the exam for different specialities is the same. It's just that for different respective specialty, we have things to prepare for. So basically, this is the format that is available on the AIOS website, which shows the list of topics, which shows a broad list of topics, which is available on the website, which involves first the basic level goals that should be covered in the exam, which involves cognitive skills. It may involve how we interpret the simple types of refractive errors, describe optic principles, describe basic refraction techniques, optical principles of common refractive surgery. Then how do we interpret topographic maps, normal corneal topographic patterns, and the list is endless. So this entire list, which involves the basic level goals involving the cognitive skills and technical or surgical skills, is available. I'll just go through the brief key points so that we have everything in clear in mind. Perform objective and subjective refraction, that is a technical skill. So what we need to learn from this is the technical and surgical skills that have been mentioned will be more related to the OSCE pattern, and use different how to diagnose refractive defects, use different prescription formulas, then validate a manual refraction, how do we analyze tear film and tear deficiency. Then coming to standard level goals, like what are the different types of diagnostic tools used in refractive surgery, more complex types of refractive surgeries, technical and surgical skills. Then advanced level goals, again, as two broad categories, which involves cognitive skills, technical surgical skills, and that involves LASIK. How do we perform surgeries like, just a second. So is my slide visible?
Yes, we can
Still visible.
We can see advanced level goals.
Where to see the slides? So sorry. Then we have very advanced level goals, which involves diagnosing and treating difficult cases such as irregular astigmatism, to formulate informed diagnostic and therapeutic decisions, collect data and analyze refractive.
Yeah.
Hello.
Yeah, Dr. Arnav, please.
Yes, sir. So the basic thing is from a refractive standpoint, we have to stay updated about the latest research, trends, and guidelines in refractive surgery. There are various sources available online, ranging from following the Journal of Cataract and Refractive Surgery, joining various societies like ICRS. AIOS has regular webinars available on that. We should attend conferences, make sure we attend the refractive sessions, workshops, different workshops that are available for LASIK. For LASIK teaching, they also teach microkeratome LASIK. There are few hospitals which offer short-term refractive surgery training, like PRK, Smile Pro. We should be going through a lot of case studies and discussions, online and offline. Participate in case discussions, engage in peer-reviewed journals. Then analyze and learn from complex cases. We should be engaging more and reading case studies and take notes from where and how to go about these cases. Time management is again very important. Practice time management by various mock exams. These mock exams are available in a few of the selected textbooks that I'll be sharing in due course of time. And while attempting the paper, just make sure you are giving sufficient time for each question and each section. The paper is not wholly and solely like a pure ratification based. It does have a lot of practical applications also. During the final preparation stage, you should make sure that you're revising key topics and notes regularly. We should be focusing on the weak areas, staying calm and focused. Now, I have tried.
Yeah, we can see your screen, and I think you can go ahead.
Sure. So I was on the slide, final preparations. So my key messages will be very concise. Revision, revision, revision is the key. We should be revising key topics which are mostly covered in our basic textbooks like Kansky, the AAO, BCSE courses. Then focus on your weak areas. Like I personally felt the complex physics that was mentioned in various textbooks behind the functioning of the refractive machines was a little tasking, and I used to prepare them at the end. Then mock exams, take as many mock exams as possible. There are very few sources available online. So you should be, while you're reading your textbooks, make sure you yourself are framing questions in your mind. Okay, if I'm reading this particular topic, what are the different sets of questions that can be prepared from the same particular topic? Take timed mock exams. They help to build the confidence. While you're in the exam room, you are surrounded by colleagues which are of the same level. They've all prepared hard. It's only when you stand out, only when you've given that extra edge of preparation. Identify areas, again, identify your weak areas for improvement, because that gives you the time during the exam. Stay calm and focused, get adequate sleep, and also practice relaxation techniques. It's not the end of the world, it's just an added degree. I still remember reading one of the messages on the clinical peanuts group that gave me a lot of clarity. Okay, this is just an add-on exam which will give me confidence, but if I don't go through, there is another chance. So I'll come back to the topics, like where and when you should go to the topics from. My personal choice during the entire course of preparation, which was roughly around maximum 2 months, 2 to 3 months, post a hectic cataract corneal refractive fellowship, I used to come back home and read this particular book by Dr. J.S. Sityal sir, Manpreet Kaur, and Sridevi Nair ma'am, which is Current Concepts in Refractive Surgery, a comprehensive guide for decision making and surgical techniques. And trust me, if you've gone through this book 2 or 3 times, you are through most of the standard and age-old textbooks like LASIK Handbook by Sir Robert S. Federer, and the other books like by Amazing Sinjab. So go through this textbook multiple times, and trust me, your concepts and your theoretical and practical knowledge in refractive surgery will skyrocket. The other book that I chose for selected topics like microkeratome surgery, PRK basics, was the LASIK handbook, which is also shared in a case-based approach. It takes care of various complications that you might come across during refractive surgeries. Then the very finest and very like concise book is by Dr. Mason and 5 Steps to Refractive Surgery, which also includes a lot of key points on how to interpret various topography machines. Pentacam is covered very nicely. Your series topography and other machines are also covered very nicely in this book. Then, yes, BCSC. I find this pretty basic during my course of preparation, but when I sat down to actually give exam, I realized that this particular book did all the concepts right from the basic. So you can start from the AAO refractive surgery module, then shift to your then shift to current concepts in refractive surgery. That will give you a huge boost and might reduce your preparation time if you're reading focused. Then complications are not mentioned very beautifully in any of these textbooks. So for that, and a lot of a high volume of high volume of questions are based on complications in refractive surgery. So please do go through this particular book. Then I will concise the preparation for practicals. Like I was telling, if you are thoroughly prepared for your theory exams. You might not require so much of hard work during your practicals, which are definitely tough. Usually there are two centers in India, that's what I've heard. One is AIMS Delhi and second is Narayan Nethralaya Bangalore. Based on the data from various sources, from seniors, and going through other Quora and Google and reviews from other seniors, I've tried to concise this in one particular site. You should be able to identify all pentacap maps from the following topics like ectasia, early keratoconus, advanced keratoconus, PMD, post-RK, post-LASIK normal or post-LASIK DTC-centered ablation, etc. These are the most commonly asked ones. You should be thorough with as many reports from different imaging modalities, just not pentacam. Sirius also, or maybe even TOMI 4 and 4 other machines. Then contact lens. How to identify Roscoe lens, RGP, soft scleral contact lenses, their uses, pros and cons, and all other related questions. Instruments like usually they just share an image, even in theory questions, of a hockey stick knife, and there will be questions related to that, like what are the different modalities where this particular knife can be used for epithelial growth removal, for even epithelium debridement during C3R surgery, and smile dissectors. What are the different types and different names of smile dissectors? What are the different innovations that have happened in lenticule extraction-based surgeries like clear, smile, etc. Newer technologies like, again, different lenticule platforms, epithelial maps, and what is their importance in decision making in refractive surgery. A huge emphasis is laid on biomechanics, Corvus maps at Narayan Nethralaya, and also I think by the decision-making bodies who are framing the questions for the theory and the practical exam. Also, there are a lot of image-based questions throughout your theoretical and practical exams, which are put up in OSCEs. I'll share a few images that we should be well prepared with. First is that of the epithelial ingrowth. Second, disc pressure-induced stromal keratitis. Third one, like for example, anyone from the audience who would want to share what this image looks like? The third image. This is one of the most frequently asked questions for the last few years. Anuj sir, can we take answers?
I think I'm unable to answer.
Yes, sir. No, sir.
So you can maybe share the
Sure, sir. So this is basically the central toxic keratopathy, one of the most frequently asked questions. I'm not sure if it was asked last year or no, but for the last 3 to 4 years, yes. In theory as well as in practical, it was one of the most common questions. Then this one, diffuse lamellar keratitis. That's why I had to go through a separate textbook for going through complications in PRK, microkeratosis, SMILE, and other surgeries. Then I would want to share one of the most and important sources for ophthalmology for preparation during my phase in post-graduation as well as during the fellowship, and also in clinical practice till date. I'm being very, very, very honest and sharing this. This has been a key source. I have sent personal messages to sir requesting to share and guide me. Sir, where should I apply for short-term fellowship? Where should I apply for long-term fellowship? What are the key sources that we should contact from? Sir has got a huge database. Sir has got a huge fan following that helps us to connect with each other and maybe share information of ophthalmology, post-graduation, fellowship, and post-fellowship to settle down in career. There's huge learnings that I've taken home and shared with my parents कि देखो सबके साथ भी ऐसा हो रहा है, मैं अकेला ऐसा नहीं हूँ. So किसी ने इतने cases करे, किसी ने इतने cases करे हैं, and maybe every day we will learn and become better. Also, we should make sure, while preparation, while during the preparation and after the preparation also, we should overcome our nervousness. I do remember, like during my post-graduation days, I used to be a little underconfident while preparing for the theory exams. In practical, I was like, come on, give it to me. So you should never be nervous. Theory or practical, just be confident. And if you're thorough with your clinical knowledge, you're thorough with your theoretical knowledge, you will ace the exams. Final tip will be just be consistent, work hard. There are other exams also, like Fellow of World College of Refractive Surgery, that have recently cleared this year in January itself. It is recognized world over. It is given by Sir Arthur Cummings and like the legends of refractive surgery. So this is another exam which is in 2 stages or 3 stages procedure, and only less than 400 doctors are there worldwide. So apart from FICO, you should start preparing for FWCRS also, and you can apply once you have fulfilled the requisite criteria, a theoretical and an interview-based exam. And like Dr. Isha told, it does help in beautification or maybe glorification for a few days. But at the end of the day, like Sir always shares on the group, at the end of the day, your patient should be happy. Your clinical and your practical aptitude is what counts. Nobody is actually coming to your clinic and counting the number of degrees that you put outside. So just be consistent. It's a new learning from a new book, from a new journal, from a new YouTube video, from just another source. Thank you.
I think that was very comprehensive, Dr. Arnav. And somehow I've heard or I've read that the retina exam rates or the passing is very high. And so someone was telling me that it is because the exam is easier. But I was trying to tell them, no, that's because the retina people, they read little more. And so how are the rates for Faico refract? Because I'm a little confused whether between cornea or Faico ref, the rates are very less.
Yes, sir. What I have heard is cornea, it's very low.
Yeah.
Refractive, if I'm not wrong, there were 21 people who applied for practicals out of a huge number of people who had applied for theory and cleared the theory exam.
Okay. Okay. So for this these exams, is it percentile based or it's just you pass and that's all?
So we do get a clear-cut pass mail on email as well from AIOS.
Okay.
There's no percentile or percentage-based report that we do get.
Okay. Okay.
I think theory MCQ it would be 70% passing marks should be there.
Yes, 70% pass rate is there, but you don't get the exact number
You
value
don't get
that what we are
the
seeking.
score or mark sheet or something like that, just a pass. this
Okay.
thing.
And is there any how we have in DNB, like you don't get the marks, but if you have like excelled very well, then you get a gold medal. So is there anything
Yes.
like this in
Yes, gold medal is there, but I think only after you clear both the examination.
okay.
So based
Yes,
on something, you give gold medal, yeah.
I think the highest scorer does get a
Most
gold medal.
likely, yes, it's the
Oh,
highest scorer.
okay. Okay. And so Dr. Isha, for you, how was the practicals? Like it was like as like a DNB exam or a post-graduation exam or like it was
So,
the
it
duration?
was more than that. Like what I felt was it's all about OPD, what you do in OPD,
Okay.
right? Even if it's an OSCE, they'll show you a total clinical pic along with their clinical imaging investigations, and they'll not just ask what's the diagnosis and that's it. They'll ask you what will be your next approach, and it's not just a theoretical thing. They'll show you a pic and what is this and what is that. No, it will be a proper approach to the thing that you're doing. And in the VIVA also, that is what they are just checking. They are checking your clinical knowledge. They'll not just ask that which drug is it. Then they'll give you a clinical scenario. Suppose this thing has happened, then what particular drug and at that particular condition, what will you give? So it's more of like that. So that's the best thing I would say. People don't like rectification all the time. I think it's the clinical thing that you should be assessed on.
Okay.
So I think
Refractive, I would definitely say, sir, it was a lot from the OPD. I could recall a lot of things from the OPD. Okay, I have done this. Yes, I think this is the answer. And even during my practical exam, it was taken by Dr. Rohit Shetty, sir. I remember everyone who was walking out of the room, they had a sad and gloomy face. Okay, it is not good. Yes, this did start from a basic question level. They took up to as high it could be, and they also were checking your practical approach towards every particular case. It was in OSCE as well, and it was in the Grand Viva as well. In Grand Viva, they completely changed the set of questions that might have been asked to other candidates, and then it was a whole new scenario, whole new thing. And even if I was answering as per what they wanted to hear, it would change the very next moment.
Okay.
Okay, they would make it tougher. They would make it tougher.
Okay. And
So if you're confident enough with your theory, it is not very tough.
okay. So, but there are no patients, right? It's we don't have to do a retinoscopy, or maybe for retina we don't have to examine a case or
no, there are no patients.
yeah. So
Maybe
Not
eventually
in
they might
refractive.
change, but I don't think
yeah.
it should.
They can keep instruments or the topography from clinics, but
Right.
not a patient.
Okay. So it's
Exactly.
barely OSCE and a VIVA. There's no like
Yes.
a clinical exam kind of a thing. You don't have to
No,
perform
sir.
anything or
No.
okay. So I think we've answered a lot of questions. So we'll just go to the audience, and if anyone has any questions, can directly go to Dr. Arnav and Dr. Isha, and if someone knows about any other specialty, then they can also join in. Dr. Purva, are you
I
there?
think there are a few questions in the chat as well.
Yeah.
Uh,
Yeah, please.
there's one question: is cataract experience for 2 years enough for FICO in Faico cataract, or do we need fellowship in Faico? For refractive, for cornea, what I know is you need to have a minimum of 1 year of fellowship in that particular branch, along with a bona fide certificate from your institute stating that this particular candidate has completed before you apply for.
I think the latest guidelines, what the site tells is 18 months of fellowship in that particular field.
They've increased 18.
Now they have written 18 months, right?
In Retina subspecialty exam, how to expect the distribution of questions in general ophthalmology and retina? So are you asked
General
ophthalmology?
ophthalmology, they don't ask. It's all retina based.
So,
It's purely retina.
I could recall there are a lot of scientist-based questions that are asked. Who was the
Scientist-based
first person
question.
to do LASIK,
But again,
first
it will be in
smile?
your particular field. It won't be a general ophthalmology.
Yes.
Yes.
Yeah, history of ophthalmology you will need to know, and depending on
Right.
what exam you're giving, so relevant history, and you will have to this.
You have to mug up few names, popular names
That is mainly for the MCQ part, I would
for the
say.
names.
And what is the gap like generally? Like you give the theory, and what when the results come, and when like OSCE, these exams are practical exams are there, or the VIVA. Like,
Yes, so I think November it was our this
Yes.
MCQ first
Like a
part, and
CBT
second
exam.
part it was in February and January, February.
okay.
That
Just
one,
before the AIOS, a month or
right,
two
before
before
the
the
AIOS.
AIOS.
Award ceremony will be happening in AIOS.
So usually what time the application start? I think as you said, it's like September, does
In
it start?
July, August around it
Oh,
starts.
July, August. And we have to go on the website to
Yeah, we
Register
should
for.
keep checking. Yeah, this is for last year's. I don't know if they keep changing the month, but Before that, you can just start checking.
I remember one of our consultants telling when they started, it was for 2,000 or 5,000 rupees. Now it's increased to 10,000
10,000, right?
rupees.
Yeah. That was, I think
The
that
cost of exam has gone up.
still it is one of the most affordable exams.
Still one of the top.
Yeah, because I remember I gave it for 5,000. So
Yes.
it is like you don't need to think twice before filling the form. You
And
can,
I think people are more sensitized about the exam now, more, and
Right.
it's becoming a little popular,
yeah.
more prestigious.
Yeah, I think because the felicitation happens in the conference, so that is one
Yes.
Right.
good thing which is for when I gave that time it was not so much of a yay, and
Okay.
but they are also doing the work. The degree is also the way they give it to you. It is worth your effort
Yes.
because so is cataract experience for 2 years enough for FAICO? Or do we need Acharya that is already taken care? If one doesn't have a fellowship from a teaching institute, can they apply for a FAIC or refractive?
As I
So
already mentioned, it's sarship and fellowship both is considered, even if you don't have this particular thing, and but you are still having some experience in that particular subspecialty, I think you are eligible. That is what it has mentioned. Rest refractive sir will tell after.
it's the experience. If you have a prerequisite experience, you need to apply. You need to upload the certificate. Uh, Only after the approval you can go into it.
Right.
So
It has
so
to be from
uh,
a
so before
Books or
the application, do we have to submit these, or it is with the application this experience and
everything is online, sir. You
okay.
have to submit then and there
uh,
itself.
right.
When you're enrolling for the
Okay,
exam,
now
that time you have to
everything is online. We don't need to post to AI.
online. No, no.
Okay. That is. I think
And the exam is like a proper NEET PG based exam, a computer based test exam. We
Yes.
have to go sit down for an hour, and the time is not short. It's just point to point.
right.
If you don't have
It's a straightforward like MCQ. It won't be those big questions or case-based questions.
USMLE type questions,
Straightforward
they will not be,
one-liner questions.
Okay.
So you can
or
do it
maybe a
quick.
very short
You know,
case
you know. If you
scenario.
don't know, you don't know. It's like that.
Correct.
If you don't know, you guess because you don't have negative.
Yeah, you guess. You have to attempt.
You have to attempt. You don't leave anybody.
Right.
So I think if you can get authorization from the head of department or someone senior for your experience, then I think anyone who has experience and not a recognized fellowship still can go ahead, right?
Yes, yes. If they don't have any fellowship or even an SRship in that field, but they have been practicing since a long and I think 3 years experience in that particular field,
Okay.
then it
Yeah,
is
I
counted.
remember there were about 10 fellows, 10 residents from RP Center AIMS who were applying for the refractive surgery. They were all from the same batch. They
Acha.
were all SS,
Okay.
9
And
to
they had
10.
to center in AIMS only, or they had to go to NN?
NN.
Acha, they had to go to NN.
They were all in it.
Okay. So I think that sums it up. Regarding MCQ, someone is asking what are the books for Retina? Any other books which you have already told Dr. Isha?
I mainly used Kenneth and Massachusetts, as I said. And other than that, I think you should also ask your peers, your even your seniors who have gone through these exams. They are better to tell you what all topics need to be covered. So just read those topics, and other than that, MCQs and BCSC also, it also has some MCQs. And other than that, I have mentioned IQ site is there. So
Right.
it also has some MCQs. Even AAO has a question bank of its own. So that is how you can go.
Okay. And do we get the question paper, or is it like it's an online exam, so no question paper, right?
Yes, yes, we don't get anything. We are
And
not supposed to take our notes also, even if we are writing there something, so we
and
cannot take this.
Yes.
so has
Yes.
Yeah.
anyone taken the efforts to follow up with the questions? Are there any question banks available? That is what the question is, that where can we get previous year's questions for these exams? Has
I
anybody?
It's just that topics,
Okay.
I tried to find a lot, tried to call a lot of seniors. They were just topics. They said कि ये topics में से आने के chances हैं,
There's
but it's
no
it's
such
never
standardized book or
there's no.
any printouts we have. It's all
Okay.
about asking your seniors. That's it.
I think that is why more mystery is there about this exam, because you don't know how to go about it. And
Right.
though now there are quite a few, the number of people who are attempting these exams have increased, I think. So we have a little bit of this. And pediatric retina, somebody is asking about how
Uh,
things on pediatric retina.
Not too much into it, like, yes, ROP can be asked, and retinoblastoma, only the major topics.
Yes.
You-
Yeah, that was the next question.
Oncology, again, as I mentioned, it's only mostly choroidal hemangioma or melanoma, that's it. And then other than that, retinoblastoma.
Right.
Not too much into the rarest of the rarest oncology. No, they are not asking that.
And
Even for
MCQs,
refractive, keep your eyes, mind open during your clinics. Ask a lot of questions. How is this machine working? They ask a lot of questions on refractive techniques, refractive procedures, refractive machines.
okay. And is there any group?
And in practicals, they ask, how did you do the refraction? What is the difference? How do you even how do you check the dominance? One of my questions: what are the various tests of checking dominance? Which eye is dominant and which eye is not dominant? Very basic question and nothing related to refractive surgery directly. But yes, it can be anything from ophthalmology.
So this exam is Faico and refractive, or is it just refractive?
So FICO refractive surgery. There is
Okay.
another one for cataract.
That is a separate one.
That is a separate
So,
exam.
so the questions were only on refractive laser procedures, or like, as people like to call these high-end premium cataract, also as refractive cases.
Not really, sir. Not really. But I did prepare. I was told that we can have a lot of questions from multifocal IOLs,
Yeah, that's
from the premium IOLs range. I did prepare for it. It is given in the books. It is definitely an added advantage if you are well versed with that.
right. Right. But it is purely refractive.
It's purely. But you do get a lot of cornea also when you're preparing from. I did read Krashmer completely because obviously I was doing my cornea fellowship. So the wound healing part from cornea, the scarring mechanism, and all those topics, they play a huge role because they are covered in the refractive books as well. So if you have your basics cleared from your cornea standpoint, you are almost 10 to 20% ready for the refractive basics as well.
How much was genetics?
I think
Yeah.
retina, they do ask genetics
Genetics, right.
questions.
One of the OSCE questions, like as I mentioned, Stargardt's and this thing, they might ask the most common gene associated with it.
Right.
So, most important dystrophies and their most common genes that you can just remember.
Okay. And are there any groups for
I don't think I
preparation?
have joined any such group.
Okay.
As I said, clinical peanuts and the retina, and I think it's
That's
more than
all.
sufficient, right? Anytime.
Okay. So I think that sums it up. Like, you need to prepare for these exams, and just after fellowship, or if, as you said, if you are having a 2 years fellowship and 18 months is the cutoff, maybe you can do it during the fellowship as well.
Yes.
Right.
Yeah.
If you have a passing exam in your fellowship duration, it will work wonders for that as well.
Yes. I think people of NN would be, yeah, because Bangalore has a passing exam, right? other places,
Right.
I
IOS examination is there.
I don't think
Practical
that,
exam.
yeah,
Yes. Yes.
they don't have an exit exam, so they're not very much used to reading as a
It's good that in a way you are studying, even if you don't have an exam, at
right.
least during fellowship you are
You're
studying and not.
updated.
Yes.
Right.
So I think we'll just close it because we have covered most of the points, and as rightly mentioned that this exam is definitely worth it because you're not losing much. You don't need to give a lot of exams. It's just 2 exams. The fees exam is not very high, and it makes you read. So again, you are after fellowship, or even if you are working as a consultant or SR, you are into the theory and both the practical part. So you are updating your knowledge, and then validation from any society is definitely it is worth the effort. And someone was asking again about short-term fellowships, so maybe we'll talk about it later. I think if anything is there. So thank you, Dr. Arnav and Dr. Isha, and both for sparing your time. I've with Dr. Isha quite some time for this because we were not able to finalize. And
Yes, yes.
Dr. Arnav for joining in because at the last minute and with his busy schedule, because again yesterday he was busy with the webinar and with private practice. So thanks a lot, and we'll try to bring other specialties also, so we can have more as a for other specialties also how to go about. And thank you. So we'll just close the session, and thanks again everyone for joining.
Thank you so much, sir, once again.
Thank you so much, sir. Thank you for the opportunity, sir.
Okay.
Definitely. Thank you, sir.